Hi, I'm Deanna Rogers, and I'm an animal and human physical therapist. I have a mobile practice called Good Life Physical Therapy for Animals. Today, I was going to talk with you about home care for dogs with vestibular disorders. Having the opportunity to work in a clinic and home setting, I've learned a lot from my clients on the various types of information and interventions that they find quite helpful in managing their dogs when they have a vestibular issue. The things that I'd like to go over with you today are review some of the anatomy and function of the vestibular system and discuss some various causes of vestibular disorders. Also, go over various symptoms of vestibular disorders and then how to manage some of those symptoms at home. With regards to the vestibular system, there's basically two components, the peripheral component and the central component. And the peripheral component exists in the inner ear. We have the vestibule, the cochlea, and the semicircular canals, and then also cranial nerve 8 called the vestibulocochlear nerve. The central part of the vestibular system consists of the cerebellum and 4 nuclei at the medulla oblongata of the brainstem. In the vestibular anatomy, what we have are some receptor organs that are located in the inner ear of the petrous temporal bone. So you'll see on this slide, and this is the skull of a human, and the top has been taken off. So we have the frontal bone here and the temporal bones down here. And this kind of triangular shape is the petrous temporal bone, and that's where the vestibular receptor organs live. With the inner ear, we have the semicircular canals, and we have what's called the horizontal canal or lateral canal in dogs. The anterior canal or rostral canal is called in dogs, and then the posterior canal in people, which is called the caudal canal in dogs. Then we have the utricle and saccule that are here. The bases of the semicircular canals are a little dilated, and that's the ampulla. And then we have the cochlea, which is responsible for hearing. The other thing to note here is here's the vestibular cochlear nerve, and also the facial nerve, which is not in this diagram but runs close to that nerve. So sometimes dogs can have some facial nerve issues when they have vestibular problems. The inner ear has these receptor organs, and they're filled with fluid with various levels of viscosity, and then also have some gelatinous caps on some hair cells. And what happens is there's then movement of the hair cells when there's changes in head position that stimulate these receptors that send messages to the brain. And the signals are sent by way of the vestibular cochlear nerve, cranial nerve 8, and then output goes from the brainstem to other parts of the brain and other parts of the body. So here we have on this diagram, if we enlarge the ampule area, you'll see here a receptor, and it's called the cupula, and this is a gelatinous kind of cap on top of this hair cell. So when the head is rotated, you'll see how fluid then swooshes over that cap and moves those hair cells, and that's what causes signals to the brain that help with balance and equilibrium. And then at the semicircular canals, below those in the macula with the utricle and saccule, they have a little different setup of receptors, and this is a gelatinous cap on top of these hair cells that's called the otolith. And on top of the otolith, over here on the right, are some calcium carbonate crystals, and those are called otoconeum. When there's tilting of the head, those crystals swoosh over that gelatinous material and cause mechanical deformation of those hair cells and send signals to the brain and nervous system, again, to help with equilibrium and balance. And this anatomy here will be interesting to keep in mind in a moment when we talk about some possible causes of idiopathic geriatric vestibular disorders. So the vestibular system functions to help maintain balance and equilibrium. And when we talk about our balance, there's 2 other additional systems that are involved, and that's the vision and proprioceptive system. So whenever the vestibular system is broken, then we rely more heavily on vision and proprioception. And that we need to keep in mind, and that will apply to some of the interventions that I recommend to use managing dogs at home. The vestibular system also helps to provide spatial orientation and movement for the eyes, and it coordinates with some other cranial nerves, 3, 4, and 6, to help with eye movement. The vestibular system helps provide input to the body as detecting static position of the head as well as acceleration, deceleration, rotation, and tilt. It coordinates with other parts of the body, particularly with the trunk and limbs, helping coordinate movement of those parts of the body with eye movement. And it does that through the vestibulospinal tracts. It also, in that process, helps provide extensor tone to the muscles that help of the limbs and trunk that help us with gravity and help keep us upright. So if the vestibular system is broken, and particularly an ipsilateral issue, then the side that's affected loses some of that extensor input. And that's why dogs will turn their body some towards their affected side. It also influences the vomit center in the reticular formation, and that is one of the reasons, too, that when there are vestibular issues, sometimes there's nausea and vomiting associated with that. So, some causes for peripheral vestibular disorders is a condition called idiopathic geriatric vestibular disease or vestibulitis. Other terminology is old dog vestibular syndrome. And we're not for sure what causes that. Some information suggests that it can come from otitis media or otitis interna that's then affected the vestibular system. Another theory out there in the physical rehabilitation field is it might be something similar to benign paroxysmal positional vertigo, which is a condition we see in humans. And what we've learned in the human disorder is that what can happen is those calcium carbonate crystals that are in the utricle in particular, it seems to where it happens most often, those crystals can actually go into the posterior semicircular canal, which is where they're not supposed to be. And because of that, with changes in position, there can be very significant dizziness and vertigo, even some nystagmus and some problems like that. And there are procedures in the physical therapy field where we can put the patient through certain positions and help move those calcium carbonate crystals back out of the semicircular canal and into the utricle where it belongs. And so this was first studied where they found those calcium carbonate crystals in the semicircular canal in 1992 on autopsy, and then a recent paper in 2016 showed that there were some broken off utricle otolithic membrane. But anyway, there's some type of debris that ends up in the semicircular canal. There's 2 physical therapists in Canada at Canine Fitness that have been trying some of the human treatment techniques on dogs with idiopathic geriatric vestibular disorders. And I've referenced for you a PDF paper that Margaret Kraling did on proposed treatment for that. And that can be the topic for another lecture. Other causes for vestibular disorders can be inflammatory in nature or infections. There can be neoplasms that cause issues with the vestibular system. Toxins, those can be medications, for example, that can be ototoxic. Gentamicin is one in particular. When I was doing more physical therapy on people, I had a few patients that got ototoxic on gentamicin. Typically with those two, we find that those are bilateral vestibular problems. Metronidazole can also be ototoxic. There can be nutritional issues that can cause vestibular problems like deficiency in thiamine, metabolic disorders like hypothyroidism, congenital structural issues in the inner ear, trauma such as in people like car accidents or falling and hitting their head, and then vascular issues like vascular infarcts, those types of things. Various symptoms, and there can be a multitude of them, and it can vary some between central vestibular disorders and peripheral vestibular disorders. But some of the more common symptoms are a head tilt. and that is typically to the side of the lesion. And a tilt would be more like this, where the ear is moving towards the shoulder. So in my case, this is a right head tilt. And then a head turn would be when the nose deviates from the longitudinal axis. So this would be a head turn, and this is a head tilt. So often the dog will tilt its head to the side of the lesion. They can have nystagmus, which is that abnormal eye movement, particularly with positional changes. Sometimes, though, depending on the lesion, nystagmus can be at rest. Dizziness can be prevalent, and it can be a little challenge to determine if a dog is actually dizzy, but often that's accompanied with some type of postural changes and ataxia. They can have some nausea and inappetence. And as I mentioned, they can have ataxia, and they will often fall to the side of the lesion. Typically, they're tilted a bit to the side of the lesion because they've lost that extensor tone that I mentioned earlier through the vestibulospinal tract. They may walk in a circle or roll to the affected side, and they can also stand with a broad base of support to help with their balance. But this can also be in bilateral vestibular issues where they won't particularly have a head tilt, but they'll be standing with a very broad base of support, and when they walk, they sway their head back and forth with that. And then postural changes, they'll typically want to lie on their affected side. Occasionally, with peripheral issues, they could have Horner syndrome due to the lack of the sympathetic innervation to the eye. There can be changes in mentation, particularly with central vestibular disorders, where they could be very subdued or even semi-comatose. Dogs with peripheral disorders find it disorienting, and they can be a bit anxious, but you typically wouldn't see them being real subdued or semi-comatose. There could be changes in conscious proprioceptive testing and hopping deficits in central disorders. However, I do want to point out a little caveat with that. A lot of times in the idiopathic geriatric vestibular syndrome, those dogs have other issues that could be affecting their proprioception, like intervertebral disc disease, that type of thing. So keep that in mind as well when you're looking at the vestibular issues in dogs. And there can be cranial nerve deficits and central or peripheral issues. Sometimes with the peripheral issues, for example, they could have some facial nerve paralysis. Their tongue may hang out to the side a little. If they're drinking water, it may fall out to the side a bit. Those types of things. Now, here is a chart that distinguishes some symptoms between peripheral and central vestibular disorders. As I mentioned before, level of consciousness is pretty much normal in peripheral, but could be impaired in a central disorder. Nystagmus could be horizontal or rotary nystagmus in peripheral, and then you might also find vertical nystagmus with a central disorder. Head tilt can be prevalent in both. Falling can be prevalent in both. Proprioceptive deficits and postural changes usually are normal in peripheral disorders and can be prevalent in central vestibular problems. And cranial nerve abnormalities, as I mentioned before, you can have that in both. And then definitely there can be gait changes, but the central vestibular dog may also have some other gait changes if they have the proprioceptive deficits. Here I have provided a link for you of a video at YouTube of a dog who has vestibular problems, and it shows a progression of how he gradually improves over the period of several days. But note, typically when these issues first start, as I mentioned, it can be very frightening to the dog and to the owners, particularly if they're circling or rolling to one side. The prognosis of these problems really depends on whether it's a central or peripheral vestibular issue. The peripheral vestibular problems have a much better prognosis for recovery, and those can improve in as early as 72 hours, but can take up to about 4 weeks for improvement. And the central vestibular problems, the prognosis in those conditions is more guarded. The other thing, too, that can be prevalent is there can be a chronic head tilt. So it's very important that we start right away with some gentle things that we can do to retrain the brain to know what is true horizontal so that we limit the risks of that chronic head tilt later. And I also like to let pet owners know this can be quite a roller coaster ride because some dogs can have another episode a few months later. Often that episode's not as severe, but also because owners have been through it once and they know what to do then to handle it, they can intervene much earlier and they seem to recover a little quicker. With this section of the lecture, I'll visit with you about some of the symptoms and then some things that can be done with the clients at home to help manage their pet with these symptoms. First thing is the dizziness. And we know that when the vestibular system is broken, as I mentioned earlier, then we need to use the proprioceptive and visual system much more to help keep that balance and equilibrium. So dogs need to feel grounded. In other words, their paws need to be touching something to help them get input as to where their body is in space. So when we do things like pick them up, or pick them up to put them in the car or to carry them around the house or whatever, when they lose that proprioceptive input through their paws, it can be very disorienting to them. So think of it like the astronauts flying in space and they get into those zero gravity situations. They can be miserable for a while till they get acclimated, where they have some dizziness and nausea because they don't have things that are touching their hands and feet to help keep them grounded. Darkness can also exacerbate the dizziness because, again, they're needing to use their visual system to help keep themselves oriented in space. So it's best at night in particular to use night lights or to have some type of ambient lighting to limit that irritation to the already broken vestibular system. And firm surfaces may feel more grounding than soft ones. And so sometimes, too, we find they might have a little more issue with grassy yards, particularly if those yards are a bit uneven with their surfaces. And sometimes transitioning between surfaces can be difficult with their balance. Now here's a video of a dog with ataxia. And in it, you'll see how the dog's head is tilted to one side, his body is side bent to the other side, and then he falls to that same side. So with ataxia, they're off balanced, not only with standing, but also initially with sitting and even lying down kind of in a semi-sternal position. So owners may need to use a harness like a Help 'em Up or Rough Wear Webmaster harness. The harness is also beneficial so that if the owner is helping the dog walk outside to go to the bathroom, we don't want to be pulling on their collar because we don't want to be doing anything to their neck. Often with the head tilt and holding a head tilt like this for a while, they can get some soreness in their neck, and we don't want to aggravate that by pulling on the collar. Non-slippery surfaces are absolutely critical. So having surfaces in the home where they can have good traction is very important. And it's important to note, too, to have those non-slippery surfaces at the food and water bowl. Sometimes in the homes, I see people are great putting runners and yoga mats in the hallways and all, but then when you look at where the dog is needing to stand to eat, they're on the slippery tile and they're expending a lot of energy just trying to keep their balance upright to eat. So making sure that there's non-slippery surfaces around the food and water bowls are very important. Because of the ataxia and the degree of ataxia, sometimes they need to be closed off into smaller spaces or crated if they don't mind being crated. Also, they might need to be blocked off from larger areas, and particularly even with stairs because they're not going to be safe managing stairs on their own. Owners can also rearrange the furniture so that if they are wobbly and off balance, they're not going to be bumping into sharp edges or into like glass coffee tables and those kind of things. And it's important too, whenever the owners are helping their dog, they just go very slowly to give that vestibular system time to acclimate and figure out what it needs to do. Sofas are another thing that often need to be blocked off. As if the dog is used to climbing up on the sofa on its own for a while, it may not be able to access that safely, so they might have to be blocked off from that. Leash walks can be done very slow and easy, and usually what we start off with first is just some slow walks out in the backyard, letting the dog get used to being moved around. And in those cases, I typically like to try and have the pet owner stand if their head on the opposite side of the head tilt. So if the head is tilted to the right, if the owner can stand on the left side of the dog, sometimes it will help cue them to pull their head up to neutral when they're out going for a little walk in the yard. And as they get better with their walks, then they can do short walks like down one house and back, and gradually increase the distance as the dog improves. And also, it's important to note with vestibular problems, it can be very, very tiring to the nervous system. So they're going to sleep more, and they're going to do best with short bouts of activity with some long rest periods versus trying to do a lot with them all at one time. Dogs can feel very anxious when their world is topsy-turvy. So things to do to help with that is a nice calming voice is important, fairly quiet areas, because again, this disorder is very fatiguing to the nervous system. So quiet areas are much better for recovery for the nervous system. Slow movements are very helpful. Soothing music, most often dogs like classical music, and Through a Dog's Ear there's about 4 or 5 CDs, and they have various types of classical music that can be beneficial for the dog to listen to. Light use of essential oils. However, if the dog's really nauseous, you have to be cautious with that, but lavender can be soothing. Using supports like bolsters, rolled up blankets and towels around their side to give them, again, more tactile and proprioceptive input. That can be calming to them. Compressive shirts can be helpful. And here's an example of one, like a Thunder shirt, can help be soothing for that. And weighted blankets or vests can be soothing. That helps provide more proprioceptive input to the nervous system. And I thought about this later as I was working on this presentation, something like a Back on Track coat, which has some pretty good coverage around the shoulders and back and hips. That tactile cueing might also be soothing for a dog with vestibular issues, almost kind of like a little swaddle for the dog. Nausea, as I mentioned, can be a common problem with vestibular issues and inappetence. Often there's medications like meclizine and Cerenia that are used for that. But I do want to note, if meclizine is given, that is a vestibular suppressant. So we want to limit the amount of time that the dog is using the meclizine because the vestibular system can't retrain itself and habituate as easily if they're on meclizine. So short bouts of meclizine use is okay, but long-term use can slow down the recovery process. Smaller, more frequent meals can be helpful if they're nauseous. Softer foods they find often more enjoyable than harder foods, at least for a while. The dog may also need to lie down to eat and may need to even be hand-fed for the first day or two if their other vestibular issues and balance issues are so severe. It's important, at least for those first few days, that you just find what you can that they're comfortable eating. A lot of dogs I know like rice and boiled chicken, or rice and very lean ground beef or ground bison, for example. And encouraging drinking of water. So it's best to put several water bowls throughout the house because they may not be able to get up and walk easily to get to their typical food and water station. So putting water bowls throughout the home will help ensure easier access to water and help keep them hydrated. Also, the bowls, a lot of times if they're standing and eating and they have the head tilt, the bowls will be scooting along the floor. So you might have to push the bowl up into a corner or against the wall to keep it steady, or use an elevated food and water bowl system. That'll help keep it in one place. And they also may not defecate for a few days because, again, they're not eating as much, and this can be scary for owners if their dog doesn't defecate for a few days, but usually that will resolve itself. And they also may need help initially with going out to potty, to urinate, or defecate if their balance is severely affected. And that too is where those harnesses can help provide support for those tasks. Postural changes, as I mentioned, are real common. And here's the difference between head turn and head tilt, as I mentioned before. Here's a dog who had 2 vestibular episodes last year in July and in October of 2018. And this picture was taken just this weekend, which would have been late April 2019. So he does have a chronic head tilt. So his head is tilting to his left. And a head turn is where the nose deviates from the long axis of the body. And as I mentioned before, the trunk can be curved to the side of the lesion because it's lost that extensor tone input from the vestibulospinal tracts and can have increased extensor tone of the opposite side that's affected. It's real important with these postural changes, and this is where physical rehabilitation can be very beneficial with certain exercises that can be done, that we retrain the vestibular system to learn what true horizontal is. And specific types of exercises will be provided in another lecture. But often I find what can be helpful for owners to do, if, for example, the dog has a head tilt to the right, if they several times a day can approach the dog on its left side, that stimulation will help them then turn their head to the left and help provide cues to that vestibular system what is neutral. Otherwise, they'll learn this becomes the new normal, and even trying to get their head to a neutral position can be quite a challenge. When the appetite returns, then I also have owners use a treat to help lure the dog to go from the head tilt side to neutral. And if that goes well, then from neutral to the opposite side, the unaffected side. Here's a video of Foster, who I showed you a photo of just a minute ago. And I have given him a Kong. Now remember, his head was tilted to the left. So I positioned the Kong so he had to turn it the other way. That's a good neutral position on that last part there. So again, when their appetite is improved, even just a little toy like this can be really helpful for the vestibular system. With postural changes, they often want to lie on their affected side. So it's important that the owners spend time in the day to challenge that and get the dog up, if possible, to a sphinx position, and also then get them on their opposite side. But when we do that, we have to also provide a lot of support with bolsters, that type of thing, so that they feel safe and secure while they're in that position. And it may aggravate the nystagmus for a bit, but then it should subside and get better as they acclimate and get used to the changes of position. Also, I like for owners to do massages to the patient's neck and shoulders when they're going through these problems, because again, with that chronic head tilt, if I'm tilted to the right, I'm going to get tight on these tissues and muscular system over here on that right side and elongated on the left. So it's good to do massage to that area. And if their appetite is back, I like to have them lure the dog, if possible, to a neutral position and massage him in that neutral position as well. Here's another bit of exercise, and I was working with Foster. He gets super food motivated, so I was trying to figure out something else to use. And so I'm trying his tennis ball. And you'll see when he goes to the right, he starts to move his feet a lot. So it's still a bit unsettling for him, even though it's been months since he's had this disorder. I practiced it a bit more with him, and he got better and better going to the right without pumping his front feet back and forth so much. He also has significant arthritis in his front feet, so he can't sit for very long without getting a bit uncomfortable. Then I did another exercise with him, rolling a ball, and you can do this with the dog lying down, but this is just making him turn his head to the right. And we're also doing a little kind of sidestepping activity with that. And as he got progressively better, what we did in this video is put some treats along the coffee table, so he had to turn his head to the right to get them. And with that one too, he was getting some tactile stimulation with the sofa on his left side, and so it made him feel more comfortable and safe trying that. As he gets better and better with it, the coffee table can be moved away from the sofa, so he has less tactile input and relies more on his vestibular system than proprioceptive system. These are just some little exercises that can be done with the dog at home, and some of them, as I mentioned, can be done first starting with them lying down, not with them standing. So pearls for some home management is go very, very slow at first when helping the dog move around, and that gives the vestibular system time to process what's going on. And then also provide good supported surfaces, non-slippery surfaces, and things like bolsters and towels when they're going to be staying in certain positions for a while. As the patient gets better and improves more, recovering from their vestibular problem, then exercises and tasks can be done with a little quicker motion. And then, as I mentioned, if they're on meclizine, we want to limit how long they're on meclizine since it's a vestibular suppressant, because that can delay the recovery of the vestibular problem. And typically, I like, if they're on meclizine, to go through a weaning versus just stopping it altogether, so that the vestibular system has some time to acclimate.